hospital. Anna says the doctor gave her a prescription, but the hospital itself was out of stock of the medicine. So the doctor suggested she try her luck on the black market. He told me that I should give her plenty of water and medicine. But I couldn't afford it. I didn't have the money for the medicine and the blood transfusions. Yellow fever spreads quickly here in the Launda slums. The fever is transmitted by mosquitoes, which thrive in the waste and stagnant water.
The next clinic is 30 minutes by foot from here. Patients can see a doctor for free, but have to cover the costs for their drugs. Since most of the people here are unemployed, they often can't afford the treatment.
The Ministry of Health allowed us to film in one of the most modern clinics in the country, built with Chinese support. Dr. Anna Araujo shows us around the yellow fever ward. But here there are now only a few suspected cases of the viral disease. The last confirmed case was registered back in June. This year's outbreak in Angola has seen some 369 people die.
At
the height of the yellow fever epidemic, the situation was critical. The number of new infections exceeded the health system's capacity. And so every halfway stable patient was discharged from hospital. They were told to come back for an assessment every 3 days. The profits from the oil boom in Angola in recent years didn't trickle down to the country's health system. Only 3% of gross domestic product in 2014 was put into healthcare, a third of the world's average. At the Ministry of Health, we hear a lot of self-praise for how the yellow fever outbreak was handled. No one here wants to hear about a crisis in the health sector. But the fall of oil prices has had an effect on the budget. The financial crisis has affected all areas, including the health sector. When a country has less money, then it follows that there are fewer resources for health. The government of Angola has adjusted the budget to the crisis situation in the health sector. Ana Montorio is appealing to the government of Angola to take its people's healthcare more seriously. Now, after the death of her daughter, she's more worried than ever about the health of her son.